folks, today we're going to start talking about the last aspect of the skeleton. We've talked about so far the cranium. We talked about most of the postcranial. Now we're down to the lower limb. So we're going to start with the os coxa. This is the 2/3 of the hip bones, basically. This makes up the pelvis, and the hip bones on either side, there's two of them, are mirrored. And the first thing we're going to talk about with the os coxa is kind of some of the points of interest that you should know. We're going to show you how to use those points of interest to side the bone. And I'm going to tell you about a few other ways to know how to orient this in three-dimensional space. Once we get the side right, then we can start working with a lot of other things. This is a very useful bone for a lot of things. We can tell sex from this bone. We can tell whether or not the individual has had babies before, all kinds of things, which is really interesting. So we're going to talk about the os coxa. By the way, just a little offshoot. Some people call this bone the innominate bone. Innominate. Not a real word. It means the bone doesn't have a name. It does. It's called the os coxa. In plural, it's osse coxae, ossa coxae, if you want to say that. But most people just call them os coxa. The os coxa has a lot of, it's an odd-shaped bone. It's kind of very three-dimensional. It's got a lot of different angles and bits and pieces to it. Hopefully I'm going to be able to narrow these down and make a little sense out of it. Some people think it looks kind of like Africa. I guess you could see that. This bone is actually made up of three fused bones, which are the ilium, which at first people thought this looked like Troy, thus ilium, as in the Iliad. So that is this kind of weird flat plain area. This is a huge space, but you can see it's extremely thin. I don't know how well you can see through this, but the bone right in the center of the ilium is fairly thin. We're going to talk a little bit about the iliac crest, which is part of what you can feel on the top of your own hip bone. That's where you set your baby or whatever you're doing with it. Then the second bone is the ischium. The ischium is this lower piece here that really makes up the sitting area of the bone. And then the pubis makes up this kind of, well, the part that goes toward the pubic area. So it's called the pubis. Ischium, pubis, ilium. These all three kind of join up mostly right here in this big socket. This socket is for where the head of the femur sets in and causes that and creates that ball and socket joint. There are some other features on this that we'll go through as we look at it, but the os coxa fuses into a single bone. So now we've got one os coxa. Okay, so we're going to talk a little bit about a few of the features on this bone, and I'm going to then show you how you can use them to side the bone. The first one, which we've already mentioned, is the iliac crest. This is this kind of spine of bone that goes along the top, and you can actually feel your own. You can palpate it right through your skin. It's right there, just below the surface. You can feel it all the way back and around. The rest of the surface of this is actually an attachment point for some of the muscles that help hold you up and propel your leg forward. This goes up when we're orienting the bone. It's pretty easy. The bone itself looks kind of like a figure eight, if you look at it like that, I guess, with only one hole. The upper part doesn't have the hole. So, the next thing I want to tell you is about this hole. This hole, as we call all holes in bone, is called a foramen. This one is called the obturator foramen, which we may or may not bring into. This socket, which we've already met, associated with where the femur attaches, is called the acetabulum. Acetabulum. Then we've got this surface right here. This is called the pubic symphysis. It is where the two sides, the two os coxae, come together, and they're fused together right here by a pretty thick chunk of connective tissue that holds these two things together. So we've met the iliac crest, the acetabulum, the obturator foramen, and the pubic symphysis. Those things should help you line up how this is. The pubic symphysis, if I can show it to you from another angle, the pubic symphysis goes toward the front and in medially, which leaves the obturator foramen kind of right in there behind the pubic area. And out to the side, not surprisingly, laterally, we have the acetabulum facing laterally, which makes the iliac crest superior. A couple other things I want to show you on the back side. The first one is this sort of bay here. This is called the sciatic notch. Just like, oh, I've got sciatica, it hurts. This is where that sciatic bundle of nerves goes through from the spinal cord out and then down the back of the leg. This is the sciatic notch. Way below that, down here, we've got this big, thick, chunky tuberosity. This is called the ischial, because it's part of the ischium, that bone. The ischial tuberosity, also known as your sit bone. This is really what takes the weight of your body when you sit down. It's not the femur. It's this bone here. That's the bony part. So when you're riding on a bicycle, for example, this is the part that makes contact with the bike seat. So they usually put extra padding on the bike seat for that. The ischial tuberosity. Okay, so let's run through them again really quickly. We've got the iliac crest, the sciatic notch, acetabulum, obturator foramen, ischial tuberosity, and the pubic symphysis. With those, you can very easily figure out how to side this. The first thing is it's shaped sort of, the entire bone is shaped kind of like a bowl, part of a bowl. So you know this wraps around your, I'm going to hold it up here because you can't see down below, but if it wraps around your body, if you held it this way, then it would be poking out to the side, and the acetabulum is facing inward. You can't have that. If you've got it upside down, you can screw everything up. So know that these are your sit bones, your ischial tuberosity. Here's your iliac crest, right? You've got the sciatic notch toward the back, the pubic symphysis toward the front, anterior and medial, and then you've got the acetabulum pointing laterally, so that the femur plugs right in there. And this is your ball and socket joint. Now there are some other features to this bone that you can look at. For example, if you look right here, do you see that? It's kind of shaped like an ear. That is called the auricular, as an ear, surface. And this part attaches up to the sacrum, which forms the rest of the pelvis between these two os coxae. Sacrum here. Make sense? So if you plug it right into your hand here, if you're doing this in actuality without these two-dimensional tests. I know the two-dimensional tests are the way they are, but if you have this out in the open and you're trying to figure out, hey, what side is this? The easiest way to do it is put this notch right on your thumb. Now don't confuse it with these shallower dips in the front of the bone. It's pretty obvious where the sciatic notch is in opposition to these. This is much deeper. So you put that right in there like a phone. And then you put your ear to the auricular surface. And then you'll see it curves around your face. So you can speak and you can say, hello, obturator. It's stupid. I know it's stupid. These are all really dumb mnemonics. They always are. But it'll help you remember this. Hello, obturator. You don't want to hold it the wrong way and call them a acetabulum. Dumb. I know it's dumb. I'm sorry. But here's the funny thing. Every time I have an actual course where everybody's out there doing the practical exam, invariably, every time, see people get to the spot with an os coxa. It's a left. So this is a left os coxa. You can tell because with the iliac crest up to the top, acetabulum out to the side, sciatic notch to the back, pubic symphysis toward the middle, boom, left. By the way, as I've mentioned this before, and I'll mention it over and over again, especially with the post-cranial stuff, we almost always hold it up to our bodies if we can. Remember the clavicle? All these things we hold up to our bodies if we can place them on there, and it really helps us not make mistakes. I understand if you're taking this online, you're going to be having to look at pictures, in which case pay a lot of attention to the acetabulum, the iliac crest, a little less so with the obturator foramen, but make sure that that pubic symphysis is there and you've got your side. If it's turned around backward and you can't see that acetabulum, well, it's backwards. So make sure you get it right. Now we're going to move down the body to the next major bone. We already met this when I joined it up with the os coxa. This, the largest single bone in the body, the femur. This is your upper thigh bone, the femur. The femur has two very obvious ends. One end, you've got this kind of dip in the middle, these sort of two big, sort of rounded ends. Rounded might be a bad term for it. Just pay attention to this big notch. See how it notches and widens out? The other end, we have quite obviously a ball. Whenever we see a ball on the end of something, we call it a head, neck, and then we've got the trochanters. Greater, which is this large wad of bone here, the greater trochanter, and down here, the lesser trochanter. Below those, we have this line. I don't know if I can, there we go. I can get the light on it. Do you see that raised ridge? This is called linea, because it's a line, aspera. The linea aspera goes down the back, and that's actually where the hamstring muscles attach on the back side of the femur. Also, the gluteus maximus muscle attaches to these outcrops. So, we also have in the head of the femur, just to clarify, we have this little dip here. Do you guys see that dent in there? That's called the fovea capitis. Fovea means dent. Capitis, of course, means head. So it's a dent in the head. That's where the teres tendon, T-E-R-E-S, which means round tendon, attaches it into the acetabulum of the os coxa. Holds that thing in place. So in case you're left with just this end, you can tell, if you see that bump, you know it's not a humerus, which does not have a teres tendon. It's a femur. All right. Greater trochanter, head, neck, greater trochanter, lesser trochanter, linea aspera, which brings us all the way down to the bottom. Here at the bottom, we have a few things going on here. We have this very smooth area, right? That is where the patella rides up and down. The patella is your kneecap. The patellar area, and then just connected to it are these smooth round areas here. That's where this sits on top of the tibia, the lower leg bone, and that's your knee. These rounded areas are called the condyles. Not surprising. We've met condyles before. We met them with the jaw. We've met them in the skull. Now we're meeting them on the knee. All it means is an articular surface, a smooth articular surface that bulges out, really is, technically. But do you guys see this big pit in the back side of it? Well, that's just how it works. Just like you've got a pit in the back side of your knee. There's that knee pit. It's not quite the same, but this will help you keep it in mind. The knee pit goes toward the back. The linea aspera goes toward the back. The lesser trochanter goes toward the back. The head goes medially, right? If I have this attached, and you're going to have to bear with me because I can't, you don't see my legs in this image. So this plugs into your body. If it was turned around, it would be your neighbor's femur. Does that make sense? So all you have to do is find the linea aspera, put that toward the back. If you can't see that, you find the lesser trochanter, put that toward the back. If you can't find those, find that knee pit, put that toward the back. We already know head is up. That's easy. Head is up, head is in. Boom. What side do we have? We've got a left. Left. There's another little trick you can do with the femur. Femurs are angled because we have hips and then we narrow them down to our knees. So if I show you this, if I set this, I'm just going to use this as my flat surface. If I set this on a flat surface so that both the condyles touch, look at the angle of the shaft of the femur. When this is set level, look at that angle kicking off to one side. The side that it kicks over to is the side it's from. As long as you have front going forward, back going backward, up going up, you can do that and it'll show you which side it's from. Pretty cool. Okay, so now we've changed angle a little bit so that I can show you these little guys. These are a relatively flat bone, kind of looks like a little rock, but they're not. They're definitely bone. You can see, if I can hold this in a way you can see it, you can see it's almost a heart shape. It kind of goes straight across the top, rounded toward the side, and then shoots down to this little point. Well, that tells you how to hold it. The nice thing is about these are patella, the kneecap. And I apologize, I can't hold this and allow you guys to look at it very well. Let me, at this angle, it doesn't work. So let me show you something about the patella that's pretty cool. If I take this patella with the pointy end down, and then I spin it and place it with that pointy end down, you see the back side has these two smooth areas. These smooth areas are where it articulates with the femur, where I showed you the smooth area on the femur. If I take that little pointy end, point it away from me, and let go, it's going to lean toward the side that it's from, just like the femur does the same when I set it down on the condyles. These will lean outward. Now, this is by far not an extensive showing of all of the features on these little bones. These are smaller bones. In fact, they are considered sesamoid bones, which are usually the extra bones in the body. They're so named because they're considered to be like a sesame seed. But in this case, these are the largest sesamoid bones. I don't think you've ever seen a sesame seed this big. But I want to show you a little bit about them. First of all, on the front side, do you guys see how roughened that surface is on the front side? And if I spin it around, look at how smooth the backside is. Yes, it's got bumps and nubs, but if you could, feel how smooth this is compared to this roughened surface on the front. The roughened surface goes with the tendon that these are in the middle of. Go figure, it's called the patellar tendon because we've got the patella and the patella in the middle. Those smooth areas on the backside, as I mentioned before, are articular surfaces, so you can bet they're super smooth. One other way to tell when you don't have a table around as to the size is if you are looking at these smooth areas on the back. Let me try to see if I can get that. There you go. You can see there's a V shape, but one side of the V is longer than the other. Can you guys see that? Let me see if I can get my hands out of the way. There we go. See how it's a V with one longer arm than the other? That longer arm of the V is the side that it tilts over to when you let it go. So when you see the longer side, the articular surface, off from that raised area, a little ridge down the middle, there's a long side of the V and a shorter side. The longer side is the side that the patella belongs to. So even if I'm looking at it on the back side, if I see that longer side, now let me do it like this. There we go. See this longer side, and I know this is the back, this is the front. So I have to, in my mind, spin this around, and I know whoosh, it's a left. Conversely, show you from the top side, you can see the V a lot easier. Longer side, shorter side. This is top side, this is bottom side. So if I spin this around, boink, it's going to go off to my right. So I have a right patella, left patella. Easy peasy. Okay, we've readjusted back to my face again. So anyway, all right, so we are going to the next bone down. This is the larger of the two lower leg bones. These are analogous to our forearm bones. Remember we met the ulna and the radius. Well, now we're meeting the tibia and the fibula. The tibia, it's not tibula or fibia, it's fibula, tibia. We're going to meet the tibia first. And there are a few things that will help us figure out what bone this is and figure out how to side it quite easily. Number one, we've got two ends to it. One, you can see there's this pointy piece that kind of shoots off. Let me rotate this so you can get a good look at it. See how there's one side that has this hook, sticks way down? Then this other side, which is relatively flat, it flares out and goes flat. Let's start with the flared out and goes flat side. First of all, these are called the tibia, well, this is called the tibial plateau, meaning it's flat. It does have this little ridge in the middle. This is where your ACL and PCL connect, your anterior and posterior cruciate ligaments, ACL, PCL. Those are the ones that always get torn by football players. So, other than these two little ridges in the middle, we've got these two planes that are clearly, again, an articular surface. And you can probably figure out that is where the condyles of the femur come down and sit on top. All right, so why? How can you tell that with the tibial plateau up, this is a tibia instead of a fibula? Look at the shape. See how it kind of shapes like, what letter would you say that is? Don't say I, because the bottom doesn't work for an I. It's a T. T for tibia. Okay, so you've got the tibia. The tibial plateau goes up front. Then you see this roughened surface here in the front. This surface is called the tibial tuberosity. It's a roughened, sticky out nub. Guess what connects to that? It's the patellar tendon that helps this come forward when you're when your quadriceps muscle pulls up, drags that tendon forward and kicks it forward. That's how it works. So the tibial tuberosity goes toward the front. Make a T. Now you know it's up. Put this little thing in the front. You've got it. You've already figured this out. But next, we've got two more big clues here. Okay, now on the tibia, we have this ridge here that I was pointing out. This is called the anterior border, which doesn't tell you much. It's the anterior border of the tibia. But the point that I'm trying to make is that goes forward. But you already know it goes forward because you've got this tibial tuberosity going forward. Finally, to side it, which gets super easy. There's only one thing you have to pay attention to on the lower end to be able to side this very well. Once you have up going up, tibial plateau up, that is top of the tibia forms a T. You've got the tibial tuberosity. There's a lot of T's in this. Tibial tuberosity going forward. Tibial tuberosity going forward, anterior border or anterior crest going forward, if you're, so inclined. And then down here, we've got this little hook that we mentioned before, right? We've got this hook hanging down. That's called the medial malleolus. Malleolus because somebody thought it looked like a hammer or a mallet. Whatever. But here's the coolest part. You can feel that on your own body. If you reach down, you know those two ankle bones that stick out to either side on your ankles? Well, this is the inner one, medial malleolus. You can guess you've got a lateral malleolus, which is actually part of the fibula that we'll meet in a minute. So, medial malleolus, if that's medial, this is up, that's forward, this is back. Which side do I have? Left, because remember that's medial. It should go toward the center of the body. If I'm holding it this way, wrong side, champ. It's got to go toward the middle of the body. Medial malleolus. Okay? Boom. Tibia done. The other long bone of the lower leg. This little dinky thing. This skinny little bone here. It's about the same width. The midshaft of this bone is almost identical to the size of the midshaft of the radius and the ulna in the arm. Difference is here, it's a lot longer. It's also got a different cross-sectional shape, but we're not going to get into that. There's two ends. The problem with this bone is those ends are a mess. They look very similar. You can see this end looks very triangular. Well, if I turn this just right, this end starts to look pretty triangular too. The only real way to tell the top from bottom that's pretty easy is this. If you look very closely at one of these ends, do you see that big depression right in here? Let me try to get that. There we go. Do you see how deep that depression is? It's quite deep. The other side does not have that depression. There's some, but actually this is an articular surface. This depression is not. You can see that there's some spongy bone showing through or some trabecular bone. Let me see if I can get it into focus. Come on, focus. You can see those trabecular bone holes. There is another articular surface here. So articular surfaces don't help. The only thing that really helps is that fossa there. Now, the top, which is called the head of the fibula, goes into the tibia. They articulate. Let's see if I can get this to fit. Just like that. That's how they articulate. Which doesn't help us much. Because there's an articular surface here, and there's a little articular surface here. This end, because of the apex, this is the head here, which is slightly larger, slightly more bulbous than the other end, which is slightly more spear-shaped. But it also has an apex. This is called the apex of the fibula, which looks a lot like this point here. Okay, so how do you do this? Best way to do it. You find that this is called the malleolar, because this is the lateral malleolus. We met the medial malleolus a minute ago. Lateral malleolus, and this is called the malleolar fossa. The malleolar fossa. Whew! Because it's a dip associated with the malleolus. Okay. So what? I'm going to tell you so what. The malleolar fossa goes down, and the hole, the fossa, the dip, goes forward. So down and forward. If I spun this around, this fossa would be on this side, it would be going backward. Nope, don't want that. Spin it around so the fossa goes forward. This is a left. Literally, the only way to side this bone is figure out where that malleolar fossa is. The only reliable way. You can then figure out, okay, this is the head, this is the apex, this is the proximal tibial articulation, this is the distal tibial articulation. Woo! We don't care. All we're looking for is, hey, what bone is this? It's long, it's skinny, it's got two ends that look almost identical. So what do we have? A fibula. What side do we have? Well, if here's the fossa, it's going forward. This will also kick out to the side just a smidge. That tells you that's the lateral malleolus. And we've got a left. Only one more component to look at. Okay, the last component we're going to look at is the foot. Remember, this is analogous to the hand, so we've got a lot of very similar things. Let me scooch this like that so you can see it a little better. We have several bones here. There's 7 of them, one less than the hand, mostly because this one's fused together. This is called the calcaneus, talus, but we're not going to make you differentiate. All we want you to be able to do is, well, if I make a line here, from here back, these 1, 2, 3, 4, 5, 6, 7 bones, instead of the 8 that are in the wrist, 7, remember the wrist bones were called the carpals with a C. These are called the tarsals with a T. And if we've got tarsals back here, we've got the metatarsals, which are these 5 rays here that go to each one of the toes. But remember, this makes up that big part of your foot. Lastly, oops, we've got a toe upside down. Lastly, we've got the 5 toes. The big toe, second toe, third, fourth, and fifth toes. We've got the phalanges of the foot. Now, phalanges are also finger bones. So finger bones, foot bones are both called phalanges. So we usually say phalange of the hand, phalanges of the foot. So we've got phalanges, which are these 14 bones going forward. You would think there were 15, but remember there's only 2 in the big toe and the thumb. So we've got 14 going forward. We've got these 5 metatarsals with a T. And then we've got these 7 tarsal bones that articulate with the bottom of the tibia here. The fibula goes on the outside here. Tibia goes here and sticks, the malleolus goes to the side, and that allows you this hinge joint that allows you to walk. Talus goes up, calcaneus goes down, big old calcaneal tuberosity goes toward the back, and then all you have to do is find the big toe, and you can figure out which foot this is. The big toe, remember, is medial, so we have a right foot. Does that make sense? Well, congratulations. We've gone through the entire skeletal system from the top of the head down to the literally bottom of the foot.